Have you ever felt like you were going from doctor to doctor, but no one has time to listen or understands what you're going through?
In this video, I'm going to review my favorite comment this week. Even though I don't have time to respond to every comment I receive on this channel, I do read all the comments. So I've decided to take the time to review my favorite comment each week and share my thoughts on it. Hi, I'm Dr. Kim Bell, a licensed physical therapist and the Vertigo detective. This channel exists to offer information, education, and hope to people suffering with dizziness and vertigo. Just a reminder, I'm not diagnosing anyone in this video, but simply responding to comments. Be sure to subscribe to my channel if you're ready to become a vertigo detective yourself.
You clicked on this video because you're seeking help from dizziness and vertigo. You feel alone and lost, uncertain what to do or whom to trust. You want real answers and practical solutions that actually work. And that's exactly what Dr. Bell is about to give you, one comment at a time.
But before we dive into the solutions, you need to know this. Most people are doing one critical thing wrong when they're trying to resolve their vertigo. Fixing this one mistake could change everything. I'll reveal it in just a minute. Let's check out my favorite comment for this week.
MJ says, I just want to thank you for your website and your book. Such a lifesaver. I had some occasional vertigo throughout the years, but this is something different, it seems. Last year, I had a viral infection that eventually went to my sinuses and ears. The doctor told me labyrinthitis. Months have gone by, but my head was still unbalanced, especially while walking. From what I have heard, I think I have vestibular neuritis. With the help of your resources, I located a vestibular PT and finally saw them. I have been given head and eye exercises. I am also doing drills with just walking around moving my head. Now I am getting relief. Having had vertigo in the past, I was not moving my head, but now I am finally getting proper guidance after many months. Thank you, Dr. Bell.
Is that it?
That's it.
That's a great comment. Okay, so there's a lot in this comment that I want to unpack here. One thing is that she was given a diagnosis. That's very interesting. She said she was diagnosed with labyrinthitis. That's what her doctor thought, but no treatment plan. So what's the treatment plan that she got? It sounds like they didn't tell her what to do, where to go. That's actually really common that you know, even if you are fortunate to get a diagnosis, it may or may not be correct, first of all, and then what is the treatment plan for that diagnosis? It sounds like she didn't mention anything specific.
No.
I'm assuming they probably gave her medication, probably the meclizine or something to suppress the vertigo.
That's typical.
But then, you know, if you're fortunate after some kind of an infection like a labyrinthitis or a neuritis, then your symptoms will just resolve. But, you know, and that can happen over the course of time. But it sounds like in this case, they didn't resolve because she's saying she still had symptoms for many months.
Right.
And then she was still having symptoms, especially with walking, right? So I'm really glad that she found my book and she found my website so that she could advocate for herself. I want to get into how to advocate for yourself in just a minute. Many people I've talked to have tried seeking healthcare for vertigo, but not found any answers or relief. So stay with me. We're going to get into that next. The biggest mistake that I find that people make when dealing with vertigo is relying solely on their healthcare provider to figure out the root cause and guide the treatment plan. And what I've found in my practice is it really needs to be a partnership, like a team with the patient and the provider working side by side, kind of in the trenches together, trying to figure it out and create a proper treatment plan. Honestly, many healthcare providers are just as confused as their patients about the root cause of the dizziness or vertigo. So I have to give this healthcare provider a lot of credit for coming up with the diagnosis of labyrinthitis. But the go-to plan of care for that is usually just to prescribe medication and hope that all the symptoms go away over time. So in this case, it sounds like MJ really had to advocate for herself to use the resources I shared in my blog and in my book to find a vestibular PT, get a referral, and get started on vestibular rehab, which is essentially the physical therapy that is designed to help with any lingering symptoms after a labyrinthitis or a neuritis if there is remaining dizziness or vertigo. If you're wondering how to advocate for yourself, stick around and I will cover that next. And I'm also going to offer a resource I created for you.
What should people do if they've gone to their doctor and been given medication but still have vertigo day to day?
Well, what I recommend is that people ask for a referral to vestibular physical therapy. So that's what it sounds like MJ did. She found a vestibular PT and she went there and got some exercises for her head and her eyes, because typically people with vertigo are afraid to move. A lot of times, especially after an incident of labyrinthitis or neuritis, motion is a trigger for the symptoms. So a lot of times people will stop moving, and moving is part of the necessary requirements to have a full recovery in a lot of cases. So I think it's really good for people to try to get back to their normal activities. And if there are some persistent activities or motions or positions that trigger their symptoms, I would say seek out a vestibular physical therapy referral. Instead of just stopping all movement, let's get a professional to evaluate you and figure out what exercises you might benefit from to work through that motion sensitivity and hopefully resolve it.
So don't just ignore it, right?
Exactly. And I mean, in some cases, it works. You hope it goes away, and it does just go away. It gradually fades over time if you can get back to your normal activities. But there are other cases after a vestibular labyrinthitis or a vestibular neuritis where there's actually damage done to the ear. Think of like a hurricane or a tornado coming through. That would be like the infection, and it left, damage to the ear in its wake. And so in some cases, you do need vestibular exercises to specifically train to resolve any lingering symptoms. And so that's what it sounds like she did. That was great. She recognized that this episode of vertigo wasn't clearing up like the past episodes she's experienced, and she advocated for herself to get a referral to vestibular physical therapy.
Good for her.
Yeah. That's why I love this comment. That's why this is my favorite comment of the week. So to recap, many patients with dizziness or vertigo, like MJ, do not know what to do if their symptoms are lingering. Maybe they've been properly diagnosed, but they don't have a really good plan to resolve the lingering symptoms. The next time vertigo strikes, remember, you can take action to advocate for yourself to get proper referrals to vestibular healthcare providers who can assess and treat you with specific exercises, maneuvers, or other strategies that are designed to address the lingering symptoms you might have.
So be proactive.
Yes.
Great.
If you found this video helpful, make sure you subscribe to the channel for more vertigo tips and balance strategies. If you want me to respond to your comment, please drop a comment on this video and I'll take a look at it. Maybe we can cover it in the next episode. Hit the bell for notifications so you never miss a new upload.
Don't forget to check out Dr. Bell's new book, Navigating the Healthcare System as a Dizzy Patient, now available on Amazon.